Okay, let's get ready to start. This webinar is being recorded for future viewing. The video should be posted within 24 to 36 hours, we hope. So if you have staff or happen to need to step away who need to see the video, or you need to see the video, please, I know that the video will be posted on the TTA help desk, and we will email out a notice to everyone as well. Everyone is on audio listen mode only to reduce background noise. If you do want to chime in with a question, feel free to place your item in the question box. We will be tracking those questions. And if you want access to audio controls in terms of a verbal audio statement, just let me know, and we'll be happy to make that happen too. We're scheduled to go until 11:30, I do believe. So in the meantime, we will turn things over to Rhonda and Jessica and Yolanda to get started. Rhonda, are you ready?
Good morning, everyone. My name is Yolanda Green, and I'm the Project Director for Tobacco Education. And I'm joined this morning by Jessica Dickin, our Section Chief, as well as Rhonda Sanders, who is the Director of Tobacco Prevention, and also our Synar Program Manager. You will be hearing from both of them a little bit later on in the presentation. We thank you all so much for joining us this morning, and we welcome you to ask questions. Like Jamie said, the chat box is open, so as we're going along, please feel free to submit your questions, and we'll be looking at that throughout the presentation, and Jamie will stop us if we have any pertinent questions that we need to address at the moment. The purpose of today's webinar is to talk to you about reporting in Ecco, as well as give some other updates. We will first provide you with an opportunity to see us navigate the 5 main sections of Ecco in your reporting screen. So today we'll be covering the Synar intervention and action steps. So as you all know, you will be duplicating your Synar intervention. So we will go through those steps and make sure that you understand how to do that and what that screen should look like, as well as your action steps. We will also go over your Synar hours and ensure that you all understand where you need to click to impute Synar hours. And later on, Rhonda will talk to you some about going to your report and retrieving those hours. We'll also touch base on the master reach section, which we discussed earlier a couple weeks ago at the LME and provider meetings, and also go through those process data questions that's in merchant education, community education and mobilization, law enforcement, and media. We will go through the merchant tracker and update you all on some of the new changes found in the tracker. And then we will end up with our reporting screen and show you the 3 pertinent tabs in the reporting screens that you can use to retrieve Synar data. Jessica is then going to talk some about the Synar Pilot Extension work, specifically your environmental scans. We know that we've had several questions about that, so we want to give you some additional details about the environmental scans, and then we'll finish up with any questions that you all might have. We will spend the majority of our time today toggling between the Ecco manual and the Ecco reporting system to show you how the manual can assist you in completing Synar work. So to start out, I'm going to go to Ecco. So this is what your screen should look like whenever you are signed into Ecco. And I want to demonstrate how to retrieve the Ecco manual. So you see I have my cursor on Help Desk. You're going to click the Help Desk tab, and then right here under Printed Ecco Resources is where you go to get to the Ecco manual. I also want to show you a few other things. When you click up here on the NCTTA tab, then you see this Synar tab right here. This is where you can find all things Synar. So our suggestion for you guys is to use the help desk as you're logged into Ecco, because any updates that will occur in any of these forms be it the Ecco manual or in any of these other sections here that I'm circling, whether it's the strategy guidance document, the tobacco survey form, or the merchant education form. These two forms are what you use to collect data whenever you're out in the field, and then you go to the merchant tracker and impute the data from these two forms. So this is where you can find the updated forms, and then these are the separated out sections of the strategy guidance document. So there's a copy of the strategy guidance document right here as a whole that has everything in it, and then these are the specific Synar sections. These are living, breathing documents, so they will continue to be updated as changes are made. So if you do print these out, please go back and check sometimes because we may make some changes. So it's really better for you to pull these up online and look at them instead of printing them out because changes may be made, and so it can definitely save you some paper and time and energy. So just wanted to show you where those things are. Okay, so we're back in Ecco. So what we're going to do is, like I said, toggle between the Ecco reporting system and the Ecco manual. So I have the Ecco manual pulled up, and if you go to page 4, this is the table of contents. So it gives you all the information for every intervention, including Synar, but this is where you can find everything that you need to know. The Synar specific pages start on page 33. So this is how to activate your Synar intervention. So I wanted to show this to you briefly before we jump back to the Ecco reporting system to show you that it is in here step by step. It talks about rechecking parts A, B, and E to make sure that all of your information is in there correctly. Remember that this year we are not adding an intervention. So where I'm circling at, this is what you're doing for all of your other interventions, but for Synar, it's not going to look like that. You're going to duplicate. So we'll go to that and demonstrate that in just a moment. But wanted you to see these screens and see the difference. So right here, you have the duplicate button for Synar, whereas in your other interventions, there is no duplicate button. So you're going to duplicate your Synar intervention. We see that a lot of you have already duplicated your Synar intervention, which is great, but you might want to go back and confirm, which is step 3, where we're at right now, that parts A, B, and E match up. You want to make sure that the information that was put in when you did the intervention in 2018 is still relevant. So any of that stuff in part A where it has the manager's name, your address, all that stuff, you want to make sure that that's up to date as well as in part B. So these are your explanations for creating or duplicating your Synar intervention. Now we're going to hop over. So you're going to click on Plan and Report. And for purposes today, we're going to use the NCTTA reporting screen as a test because we don't want to be in anybody's stuff. So when you go into your intervention, you're going to click Create and Edit IP. So this goldish orange button right here is what you're going to click on. So you'll go there. So you're going to search by contract year. You want to go to your 2018, 2019. Click on that because you're going to your previous Synar intervention. And I'm going to scroll down until I find a Synar intervention. And here is one. So as you can see, all the other interventions that are not Synar don't have a duplication. This one does. So I'm going to hit duplicate, and it says duplicated IP created successfully. Then you might say, where did it go? So we're going to scroll back up to the top. So the new feature for this year is whenever you create interventions, they come back to the top. I know that some people had some issues with that before because you would create an intervention and then you would scroll, and all of your new interventions were at the bottom. So this year, you're going to scroll back to the top and find that intervention. So now we have Synar up here at the top. I'm going to type in new just so I can keep it separate. I'm going to click on 1920. I'm going to say Wake County, since we're here in Wake County. And I'm going to hit save. So now that it's saved, then I know I can start from the bottom. So now I'm going to look over part A. And in order to go in here, you see it's not allowing me to do that without hitting edit. So I'm going to edit part A. And then now I'm able to click within the boxes. So again, this is the TTA test intervention. So that's why we have Alex's name in there. You want to double check that your funding source is correct. So it's going to be the SAPBG, the Substance Abuse Prevention Block Grant is your source. Jessica Dickin is your state level manager, and her email address is right here, jessica.dickin@dhhs.nc.gov, and then we just created a phone number. Okay, so assuming that all of that is correct, you would click Save Part A. So now Part A is saved. Then you're going to go to Part B. Again, in order to edit, you're going to click Edit Part B. And Jamie said something really important the other day. Even though we see in here Synar is already selected, you want to still go in there and just do that to make sure that the system has it. He said something about you want to give it another little click. Make sure that environmental is chosen, universal direct is chosen, universal indirect, is chosen, and the service type is definitely Synar. Then over here, some people had questions about what does this mean, this setting and location. We have some providers that may have multiple settings where they do Synar. So if you want to put in a different location, if you have several counties, several different places, this is where you can do that. And over here, then you can hit add an additional location. So assuming that, let's see, put 306. Oh, a minute, that's where I was going. Okay. And then I'm going to say July through June 30th. Okay. Then once I'm done, I'll hit Save Part B. Now I want to caution you on this next part. So what we're working on, what is supposed to happen is, and what will happen shortly, hopefully within the next few days, our developer is working on this. Once you go through that step that I just showed you in Part A, B, in Part A and B, once you click on this, your action steps are supposed to pre-populate like they do in your other interventions, but we noticed that there was a glitch here. So we just have some things typed in right here, but your action step will be pre-populating, and those action steps are directly in line with your guidance document. So back where I showed you, let me go back and show you this for a second. If you go back out for a moment, I want to make sure that you all get this. If you go out and you click on the help desk and you go back to NCTTA, you click on Synar. This information here in these different sections, this is what is pre-populating in your action steps. So when we say action steps, these are the action steps. But remember, for merchant education and for the tobacco purchase survey, those won't be in there because we are not requiring you to do action steps for those. But I just wanted to show this to you so that you'll know what is actually in there. So what will be in there is these pre-populated steps right here where it says prevention providers will identify and determine the level of interest and involvement of community partners who share the goal of reducing youth access to tobacco products. These are specific meetings that your organization is putting together. If you're pulling together community partners, other folks in your community for the sole purpose of talking about tobacco access, youth tobacco access, then that's where you count these community meetings. So the only things that will pre-populate in your action steps are going to be this section right here. So these three under community education and mobilization guidance, these under law enforcement related guidance. So all of those are going to pre-populate. And then these that are under media and public relations. So again, you're not doing action steps for anything in merchant education. Reason being is because we can get all of this information in the merchant tracker. So no action steps for here. And then under community education and mobilization, nothing down here under tobacco purchase survey, because both of those are entered in the tracker. You will only have the first three and then law enforcement and media. Okay? So let's hop back to...
Yolanda, we do have a question.
Okay.
Is the location box required when we're setting up the profile?
No, it's not. That's really for you to keep up. And I think that it's more pertinent that you put something in there. Like I said, for some providers, we were working with a provider last week that had multiple locations, and she wanted to have those all entered in. So it's really for your purposes. The intervention will still save. It's not going to mess up anything if you don't put anything in that section. It's not a required box, but it's really there to help you differentiate between the places that you'll be doing the Synar work. Any other questions? Okay. All right. So if there's no more questions about that, so we want to show that to you. So that is how you duplicate your intervention. That is how you're going to put in what those action steps populate. You're going to go, let me go back to that really fast. I'm going to show you one thing. Okay, I just pulled up one just to show you really fast. So the action step will be right here. So those things that I showed you in the Synar guidance document, they'll be right in here. So when you come back and you report on those action steps, under actions taken, this is where you're going to report what actually happened. If you've already done it, if you've already done that particular step, or if it was something that, you know, or you're still working on it, this is where you come back and put that. You're going to put who's doing it, the responsible party, any location notes. Again, if you have multiple locations that you're working in for your Synar work, this is where you would put it. Any resources that you need, you know, I know that Jessica talked some in the meetings about, you know, sometimes we might have natural disasters, like we just had Dorian on last week. So if you start an intervention and then something happens, you have partnered with a particular school, and then you go in and it's not working out the way you thought it should. This is where you could put in some information about that if you need additional resources or something, or just to give an explanation. I know we talked about that at some of the meetings. So This is yours to kind of keep up with what you're doing, and we'll be in here checking those as well. You want to put your projected start and end date in here. Some will go throughout the entire fiscal year, but then you may have a particular action step that's just for a shorter period of time, so you might want to put that in there. And then if you need, if you would like TA on a particular action step, this is where you would put that as well. So you would answer yes or no in there too. And then whenever you wanted to add, you can always add additional action steps as well. So in addition to any that pre-populates, I know that Jamie was talking about that, you can click this button and add any additional action steps. Maybe there's something specific that you need to do that's specific to your organization for something that you're, for a particular intervention. So you can always add an action step as well. So any questions about the action step descriptions, actions taken? The main thing is to note that the action step description is going to be in here. Last year we had some people putting those down here and it was kind of mixed up. So the action steps are going to be right in here. And then you're going to answer what actions were taken in there. Okay. All right, so we're going to go out of that. So now we're going to, and so we've already, that was creating the IP. Now we're going to talk some about Synar hours. Okay, and so that's really easy. That's going to be this blue button right here. So you'll click that, and then you'll type in the name, and then you'll click on the intervention. So you have your interventions in here. Again, this is our test agency, so we have a lot of different ones in here. But you'll click on that, and you'll select your date if there's a different date than what it is for that particular time period. And then something new that we want to show you. So for all of your other interventions, you have this additional box for documentation, training, planning, travel. And then you also have a specific box for direct hours. So for Synar, because we have these other tabs, these are your direct hours. So the hours that you are out doing merchant education or having a meeting, those are your direct hours. But now you're also able to capture your travel time, any specific training time, your documentation time, time that you spent documenting, doing this, and planning. So all of the interventions now look similar. If I click on life skills, see how that is in there. But Synar looks a little bit different because you have these direct hours under these specific tabs. So now that's changed. So these are your direct hours, and then you have documentation, training, planning, and travel in here. So if I start clicking on here and I put in 5, 6, 7, 9, you see how that's changing up over here on the side? So it automatically populates for you on the side. Then you would hit submit. You're going to say yes, update it, and then success. So you have it in there. So let me show you where you can go to see those hours as well in the Ecco manual. In the Ecco manual, you are going to go to page 53, and that's how you see your hours. That's how you see your hours. So it's telling you to go to plan and report. Then it's showing you the blue button that I showed to you earlier. Then it's telling you to click on the Synar intervention and to put in your name. And it has your screenshot there, which is exactly what I showed to you. So again, your direct hours go in these blocks, and then any additional hours, the same way you report for your other interventions, goes in the documentation, training, planning, and travel. So hours can be captured between pages 53 and 58. So you have all of your explanations for that. Any questions about hours? Okay. So now we're going to go out of that and get into process.
Yolanda, we do have a question. I'm sorry.
Okay.
This relates back to the hours. Does documentation, travel, training, and planning count towards the required 8 hours per month?
Yes, it does. So yes, it's just a way that you guys can just track your indirect and your direct hours, but it does count towards your your required hours.
Any other questions about hours? Okay. So now, if you're going to process, so you're under 1920, you're going to find our Synar intervention. So as you can see, the difference between when you click on the Synar one, you have this middle button, this merchant tracking button in the middle. So that's how you know that you're on the right one. And then this is where you click to look at process data. So we go to process, we're in September 2019. We have our master reach up here. We're not going to spend a lot of time talking about that, but just to reiterate, this is where you put the number of new participants in any reporting period. So if this is for September, let's say I had 10 new participants. Are these the exact counts? Yes, because these are maybe the merchants or clerks that I ran into whenever I was doing merchant education. So I'm going to go down and put what that age range is. I'm going to put whether or not what their Hispanic origin is, whether they were Hispanic or Latino, not Hispanic or Latino, what their racial category is, and put that in. If you remember during our trainings, we were talking to you about 2 different times that you'll probably put in numbers here, and that will be each month. Whenever you're doing merchant education or you're doing some type of activity, you're counting the new participants, new people that you're running into. So these are your clerks, managers, store owners, those folks, any new folks that you're running into, because you don't want to count them multiple times in one fiscal year. Then the other time that you would probably be entering numbers in here, and these would be bigger numbers, is when you complete 90% of a particular segment, whether that be a zip code, a county, a city. That's up to you, and you're going to use that tool that Melinda talked to you all about, and it's also in the master grid. And you'll use that to calculate through census data the 12 to 17-year-old population for that particular segment, whether it's a zip, county, or city. And then that's when you'll impute that information in here. Again, you're just doing that once in that fiscal year for that particular age group. So you're not going to count the kids, during the regular months whenever you're doing your merchant education, and then do the massive counts on top of that. We really want you to complete a whole area. So once you have completed 90% of a particular area, and that means you had, let's say for merchant education, let's say you got 100 stores. So once you have gone to 90 out of the 100 stores, then that is when you're going to do a clean sweep for that 12 to 17 population. Any questions about that? Okay, so then we have community mobilization and education. Again, these are your yes/no questions. Under community mobilization and education, this is not your typical coalition meetings that you're just going to, that tobacco may be bought up. That's not where you count these. These are, look at these as the ones that you pulled together. So if you took the lead in pulling together a community meeting and pulling those partners together, then that's where you're going to count this. So you can say yes or no. When you say no, you see that those additional boxes go away. When you say yes, you get additional prompts. So then you're saying how many community partners were identified, and then you're asking whether or not they're active or non-active. If you say yes under here, what community leadership, well, how many meetings did you and your partners and local retailers did you have? What strategies were implemented to reduce youth access to tobacco this reporting period? And then under here is where you report tobacco surveys. So going back to what we talked about earlier, you're not going to have any action steps for tobacco surveys, but you would report here in your process under community mobilization and education for tobacco surveys, and you're going to answer yes or no, and then answer these other questions, and then make sure that you are filling out your tobacco purchase survey form, and then you're imputing them into part 2 in the merchant tracker. Any questions about that for community mobilization and education? Okay. Then you have merchant education. So you might click on this and say, okay, where are the questions? Well, they show up once you click into the box. And so now we only have 2. We took the other one out that said identification of tobacco outlets, because you're already doing that. We can see that in the merchant tracker. So under here, you're going to click this one, merchant education. If you as the provider, if you're providing the merchant education, so we have some providers who use youth, or they have youth groups or the part of a coalition that actually goes out and they conduct merchant education. But then some of our providers actually do it themselves. So this is where you're going to click if you do it yourself. If you use a youth group, then you're going to click here. Then you get an additional prompt. It says what local youth groups did you partner with. So if this is your own youth group, you know, the SAVE, whatever coalition out of Forsyth County, whatever it's called, you're going to put it in here, put that name of that youth group there. So you have 2 choices under there. Any questions about merchant education? That was really simple.
Yolanda, we do have a few questions coming in.
Okay.
Let's see. Do tobacco talks to youth group schools count as Synar community collaboration?
Tobacco, those are just tobacco talk. It's not specific to Synar. Synar, when you think of Synar, look at it as access, youth access. So we're talking about the youth access laws, not tobacco prevention, not talking about the dangers of tobacco, the adverse health effects. You're thinking about specific things around, you know, tobacco retailers, how to reduce access in your local communities. Those are the type of things that we're thinking about. That's Synar. Does that answer the question?
Perhaps. If not, we can circle back around.
Okay. Yeah, please resubmit if that's an answer question.
For community mobilization, we're pulling together a meeting of school personnel about vaping policy and access count, or is it only for retail access?
So this is Jessica. Hello. I would include that. I would consider including that in school policy work under environmental strategies.
Okay. If we need to follow up there, I will track that question as well.
Okay.
Are those the only questions, Jamie?
I have a couple of more that's just general questions I'll save to the very end. That's not specific to this screen.
Okay. Okay. All right. Well, y'all keep them coming. Okay. So now we have law enforcement. So this is really, you know, when you're partnering with your local law enforcement officers, if you're able to do any actual compliance checks using minors, that's really what a lot of this section is about. If you say yes, then you're going to answer this. One thing that was included from last year, which I really like, some of you have really taken the time and effort to make those investments, you know, trying to partner with local law enforcement. And before, we didn't have a select current level of support. So if you weren't able to get the meeting or nothing came out of that conversation, it really wasn't a way for you to report that. But now with us having current level of support, you can still put in, you can list those law enforcement agencies that you took the initiative to contact to promote increased enforcement of youth retail tobacco sales laws, and then you can put what their level of support was. You know, if they weren't interested, you know, we want to know that, because we still want to know that you did the work. You know, you can't help that they weren't ready. Or maybe they are supportive and considering increased enforcement. And then this is the one we really want to get to, where it says conducted youth retail tobacco sales compliance checks. So where they actually agree to it and then you're able to do that, and that's a win-win. But definitely capture those other things. Even if we weren't successful in the beginning, we still want to see that. Question 14, whenever you click yes, this is assisted in implementation of tobacco compliance checks and retailer training. So if you actually went through with the compliance checks, then these are several things that you can click as you, as the provider, things that you were able to do. So you served as an adult observer or monitored during an enforcement operation. You recruited and age-tested youth for the enforcement operation. You provided some incentives for clerks. You provided some refreshments for the youth volunteers. You assisted in coordinating and recruiting store employees to participate in retailer trainings conducted by law enforcement. We also talked at the LME and provider meetings about the new online tobacco retailer training that AOLE has come up with. So if you did do some compliance checks and then you were able to advertise for that, maybe you would click right here. Retailers cited for violations of youth access to tobacco recruited to attend that training. That's where you would click on these things right here for retailer training. So these are other tasks that you as the provider would click in to say that you did that. And then this is where you list the number of retailers recruited for that particular training, or provision of snacks, number of compliance checks conducted, and then also the number that participated, because now I have those checked. So it just keeps adding on depending on which one you select. There's additional questions. So that's pretty much it for law enforcement. So again, going back just to recap, community mobilization education are for those meetings that you all pull together that are specific to the youth access law. So thinking about reducing youth access whenever you think about community mobilization and education. Like Jessica said, any other meetings that are just talking about tobacco prevention, tobacco education, the dangers of adverse health effects, you're not going to put those in here, okay? Merchant education, you're just going to click which one, whether or not you as the provider did the merchant education or whether or not you use a youth group. Law enforcement, these are really for your compliance checks. And then lastly, we get to media. With the Synar Pilot Extension, if you all are doing billboards or any type of media, any type of stories, we definitely want you to report it here. So you'll click yes in here, and then you will identify what type of media it is, whether it's radio ads, billboards, TV ads, letters to the editor. You'll put what the media source is. This is where you'll put your reach. Again, we're not going to put any printed sources here. You'll put them in the briefcase. If you all remember from our LME provider meetings a few weeks ago, we talked about that. So we're not putting them here, we're putting them in the briefcase. And then you're clicking on your media type, whether it was paid or unpaid. And so we definitely want to make sure that we answer these questions. And so again, if you are planning on doing any media, you want to make sure that you do your action steps for that media. So I know some of you are doing billboards. You already know that those are the things that you're going to do for the Synar Pilot Extension. So make sure that you do your action steps for those so that we know that that's what you're planning to do for media. Then you have one last question under media that says, collaborated with youth groups, conducted a merchant pledge campaign. and publicize the results. This is another activity that you can do along with your retailers if they, say that they want to pledge not to sell to you. You can do a pledge with them, and then this just asks you how many merchants pledge not to sell, and then you're going to specify how you plan to recognize those stores. So if you want to do any billboards or print ads, TV ads, radio ads to publicize the results. Then once you click in that, you want to make sure that you hit save at the bottom. Oh, because I didn't put anything in there. That's why it's not saving. Oh, I got to do the master reach. So you see that red alert right here? So the numbers have to match up. So that's why that's doing that. So want to make sure that you fill in your master reach. So it's alerting me that my numbers are not matching up because I got numbers up here in total participants, and then I don't have any numbers through here. So that's actually a good thing. So it makes sure that all your numbers match up. So any questions about process or anything else that we've talked about thus far?
Yolanda, I do have a question.
Okay.
This is going back to merchant education.
Okay.
Could you clarify some of the differences between direct and indirect errors?
What's the question again, Jamie?
Yes.
Going back to hours?
Yes, what parts of merchant education would be considered direct or indirect errors?
Okay, so I think what we maybe can clear this up is the breakdown in reference to when you planning, traveling, etc. is just a breakdown of how you can project how many hours you have spent doing those things. But your direct hours will total whatever those 4 boxes are for Synar, if I'm correct. Because when you are out traveling from one location to the next, you are out doing your merchant education, so that will be it will count towards your requirement of the hours that the LMA has tasked you to do. Is that clear?
And I think the direct hours are your actual hours that you're doing merchant education. So some people, like Rhonda said, some people might want to account for, okay, it took me 2 hours in travel time to get to all these locations, but the amount of time that I was actually doing the merchant education, like let's say I spent 20, 30 minutes in a store or something. So this just allows you to be able to account for that. Before, when we didn't have this right here, you had to put all of your hours right here. So let's say you spent, let's say you went out and you did merchant education in one work day. So that was 8 hours. Let's say 3 of the hours was actually spent in the store talking to merchants. And then let's say 2 of the hours you were driving. And then let's say another hour you did the documentation, you were imputing data. So now this allows you to be able to separate that out. So,
but it all counts towards your requirement.
Right, and it all counts towards, right. Not meant to confuse you, but basically you're just separating it out now. Does that answer the question? So when you're actually doing whatever it is, then that would be like your direct hours. But leading up to it, like your plan, let's say for merchant education, we know that there's some planning, some pre-planning involved. You have to print off your list. You have to plan out your route. So you would put, maybe you spent an hour doing that. Maybe you were out in the store. I got an inner staff name. Maybe you were out in the stores for a total of 2 hours. So I have 2 hours there. Let's say I traveled for 2 hours. And then let's say I documented when I got back for another hour. So you see how all of those just added up right here in my total? So I got my 2 hours that I was actually out passing out the red flag merchant education materials. I got my hour that I came back and I imputed the data in the merchant tracker. I got my hour that I use to print off my list and get my list together to do the merchant education. And I got my 2 hours that I use to drive around in my car to get to and from the locations. But they all add up to my 6 hours. That makes sense?
And I would imagine if you're part of the Synar Pilot Extension, you're probably going to have more than 8 hours for August and September.
Yes, definitely.
And that's okay.
Definitely. We just wanted a way for you all to capture it. That was a request, just to make it go more in line with your other interventions, because the other ones have that breakdown. So just look at it like this box right here, direct hours, is taking the place of these right here, because we have these different sections, whereas your other interventions, you don't have all those sections in all of them. Okay.
Thank you.
All right. So now I think we're gonna get into merchant tracking. Okay.
And so the first part I would like to share with you guys is let's go to the Ecco manual.
Okay.
Starting on page 129 is where you can get the step-by-step process in reference to how to complete the Synar Merchant Tracker. Please keep in mind that the tracker is as great as the information that you input in there. So as much information filters that you can complete will be beneficial to us tracking the merchants that you actually go out and educate, as well as continue to improve the list that you have, particularly in the state that does not have tobacco license. One thing that I want to point out to you that this year, please, the point of having the Synar intervention duplicated is that you guys did not have to, that we want to transport your merchant list over in your 1920 intervention. So please do not upload a new list. As the directions are showing you that you can't upload, please do not, because that will just create a lot of duplication in the merchant tracker. So as the first screen, we start with the home screen where you would start at the plan and report screen, and then that screen will take you to the icon. So the plan and report screen. Then we will find your agency, and for the sake of this training, just Ecco TTA. The 1920 is where we will start. Then we go down to the Synar Merchant Education, and then the icon that has the little house in it in the middle is where your merchant tracking icon. Okay. So here I did mention already about no one should be uploaded in their merchant list. If you did have any questions about that, please contact us before doing that, because again, that will create duplications. What I want to point out to you is that we have plenty of filters here. We have plenty of filters. I'm getting notes that you guys can hear, can't hardly hear me. Okay. We're switching around. So we have filters at the top here. You can sort by merchants here at the top. The drop down button is the latest ones that was uploaded. Any that you want to follow up on. If you want to just search by a particular merchant's name, you can do that. Visit outcomes. You can search by visit and the number of visits that you completed, the ones that are temporarily closed, out of business, etc. Types of merchant, if you have routine visits, please keep in mind that we are asking you guys to not visit a merchant no more than 2 times within a fiscal year. If you have to do some merchant, a manager follow-up, etc. Type of follow-up visit, it's the same. You might find some stuff out there that you might need to refer to the FDA website, or you might want to try to refer to ALE. You would note it there. And these are some download filters where you can say how many visits you completed. And then here, about routine visits. Is it a list that you upload? So this is how you download. Okay. All right. So this is, so on this, if you were trying to filter out under the download filters, under visit outcome, type of merchant education, type of follow-up visit, you would use this download button here to get that list to pull up. Okay, to edit any merchants, to edit any merchants, you might find out that the merchant might have changed his name or changed the business. Then you would hit the edit button at the top there, and you will click in here and type the name. Hit the save button. As far as the merchant visits, you go to part 1, and you will complete who you spoke with, the provider that completed it, what type of visit it was, any notes that you want to add in there, if it was a routine visit or a follow-up, and the date. It's very important to note the date, particularly when you get ready to pull your reports. If you noted any signage, any follow-up, just as much information as you can to complete this merchant education visit and the questions within it. And as always, please remember to hit save. Hit the save button, so that means I did not answer all the questions, which is a great feature to have. So let me put my name in here. And here, you don't necessarily have to put visit notes, but it's important if you want to note anything, say that the business moved or anything like that. And let me say that you saw the signage. If you did not see signage, note it as follows. Follow-up, it'll tell you what type of follow-up. Does the store need to be removed? I'm saying no. And I have to click no. Okay. So it should save now. Okay, so this has been saved. Now, part 2 is where you do the tobacco survey. And this is one of the things that is in the Synar Pilot Extension. So here, this is where if you were to go to this particular merchant, you would go to part 2 to complete this portion for tobacco survey. And then to note the clerk's gender, the inspector tested age. We are asking you guys to make sure that all your inspectors are age tested, even though they have to be 18 years of age. We are asking that they be tested and see what the average age that they test for. Let's say they're 17 in this point. Here, when it says inspector initials, this is referring to the youth buyer. So you could say that is OG. I'll put OG here. And then you put your name here. You put any notes that you want to note about this survey. And then kind of just project out the estimated clerk age. And if the clerk asks for the ID, yes or no, because that's primarily what you guys are testing when you go out to do tobacco surveys. You're saying if the clerk is going to ask for ID. And then the gender of the actual youth buyer. And please make sure you put the date on there.
Rhonda, we do have a question when there's a stopping point.
Okay.
What does add rationale mean? RATIONALE.
I didn't hear the question.
What does add rationale mean?
Oh, add rationale. Okay,
Yes.
that's a good question. All right. In the reasoning of the tobacco survey. So in this case, let's look at those portions. It could be other, because for the Synar Pilot survey, it's not anything that's prompting you. Well, technically that's not true, because if you use your FDA list, remember Jessica mentioned that you guys to go back at least 3 to 6 months in your catchment area in reference to starting out with where you should start with the tobacco survey. In that case, you will use FDA non-compliance in there for the rationale area. Okay. So that's what you should start out with, is that list. The FDA list is on the website. She asked for you guys to go back at least 3 to 6 months to find out if you had any locations that were cited a violation with the FDA checks here in the state, and that's what your rationale would be for your tobacco surveys. If you find that you don't have any in your area, then you know, at one point we are planning to give you the Synar results once we have the Synar survey. So that might be another reason for you to go out and do a tobacco survey. Or it could be other, and then I suggest if you do other, then you probably want to put some visit notes there as what prompted you to do the tobacco survey. Okay. Please remember to save, because if you don't save, which it shouldn't allow you to leave, like I said, I haven't did all my mandatory fields, so it won't allow me to save it. So these are great prompts to have. So what have I? Oh, that's right. Because I need to put the visit outcome. So were we able to complete the visit? Did the store move? Was the store in a refusal? Make sure if it's unsafe location to note these items here. Okay. So that's part 1 and 2 in the merchant tracker. I do want to bring to your attention, we have the feature of deletion.
And it's not showing up in this one because this is a test one and there's not multiple stores. So we're going to go out of this one really fast and see if we can find another one that has more in there.
So in this case, if we are not able to find it, refer back to the Ecco manual. And in the Ecco manual, it goes step by step in reference to how you can delete a particular store. And you can sort your list within the dashboard with the download filter. So remember, I had about visit outcomes. If you found some that was store temporary closed or have moved, or well, I should say store out of business, you might want to bring those up, and those will be the list that you will work from in reference to trying to delete them. And it only allows you to delete a store at a time, so that's great that you can't group them out to delete, so that you can make sure that the ones that you are deleting are stores that you actually want to delete from your list.
Okay, so we have a question. It says on the merchant education list, when do you hit add merchant visit button? If your store comes up that is already on the list from last fiscal year, are we editing the information that's already listed?
Okay, so once you have, so what happens is you can come here to the search merchant. So you'll put the name of the store here, and it could be, I'm not gonna say BJ's, let's say Speedway. But we don't have a list so that we can show you how it looks. But then that store should come up here under number 1.
We're gonna go to Coastal.
Okay.
Coastal, if you're on the call, since you gave us permission to use your list in our meetings, we want to use you again, if that's okay. We need to go to one that actually has a list to show you this feature, because these testing agencies don't have enough information in them.
Okay. Okay, so with this one, we go to Go Gas. You see where it says Part 1 visit? So if this person, this store was visited on October the 18th, 2018. You see that that one is there. To add one under Go Gas, you would just say add merchant visit here, where then you can note the visit that you want to complete as if it was today. Add in the store. Editing the store, okay. So let me go out of here. Go to the edit button here, and then you can be able to edit the store in here once you hit the edit button at the top. And if you wanted to change anything in any of these boxes, then you can hit save.
And if you want to actually add another store, if for some reason, then you're going to scroll down to the bottom of the page, and you get the prompt that allows you to, okay, add a store. You see add merchant down here. So you can do it one of two ways. You can edit your merchant, or if you're out doing merchant education and you find a brand new merchant, you can add an additional merchant. Okay, and then that goes back up at the top whenever you do that.
And once you start editing, you'll notice too that there's the X's on the far left hand side. So if you see that you have duplicates, go down. See the X? You can get rid of some of those duplicates.
Yes. We're not going to delete your store, but we're going to show it for the sake of.
And then tell you, are you sure?
And we're going to cancel it in this case, but you have the option to double check it before you actually delete it.
I remember some of you mentioned, oh my gosh, we had so many duplicates last year. You'd want to go in and check and make sure that the information is accurate before you update it, but you can delete stores as well.
Does everybody see that? You have the X's over here to the side. Once you hit edit at the top, that kind of unlocks everything. It unlocks it for you to edit within the entry, and then it also unlocks the screen for you to do deletion. So if you had gone out and did your merchant education, and let's say you have a list of stores that are no longer in service, you could come up here, search for those stores, type in the store name to get it to come onto the screen, hit your edit button, and then scroll down and then start deleting. Once you hit this, then you're going to get this additional prompt that asks, are you sure? And if you hit yes, delete it, then it's going to go away. If you do hit that in error, you didn't mean to delete, you have two different choices. If you still have your merchant education form, you can just go back and add a merchant and add it back to your list. But if you had some merchant education visits connected to it and you didn't want to impute all of that data again, we're told that the data is still in the background. We could get that back for you if you do it by accident. But just know, once you click that black X right there in the circle, then this is going to be your additional prompt that comes up. Okay? Any questions about merchant tracker?
Do anybody want so we now the next thing is to download the CSV file so they can see the black file. Okay. So here you're able to put your filters on. Let me do that. This right there. Okay, thank you. That's the wrong thing. Okay. Okay, so here, this will be important. Like when you guys are talking about doing the coverage study, you would probably want to utilize this CSV file to find out if you want to find out how many merchants by zip code. You can just select the 28. This is an example 28401, and then say okay. Then they will come up at top here. You see you have 66 locations in that zip code. So then you do 66 out of 90%. That will let you know how many you have to complete in this particular catchment area. So this CSV file will be beneficial once you are trying to do your coverage study in the Synar survey. If you're doing it by county too, you can see here, you can sort by county as well. So it goes across the board. It also lets you know when you actually did the last visit as far as your merchant education. So you can utilize the CSV file to help plan your routes out even for merchant education. I just did want to bring that up in reference to the project that's coming up.
So as an example, I'm just going to chime in just for a second. So like Rhonda said, in this particular zip code, once she filtered it, she has 66 records. So 90% of that is 59. So once you've done 59 of that 66, that's when you count that 12 to 17 population. So that's an example of that.
Any questions about the CSV file and how do you find the stores in a particular catchment area in reference to you in preparing for your coverage study? Okay. We're going to move on to reports. Is it correct? Okay, so the 3 areas for reports is Synar hours overview, and you can put in your agency name, and then the overview will give you how many hours you have reported from a particular period. So let's see how many were reported potentially, let's say for July to August, or July to August 31st. We don't have any, we might have to go from that. But at least this screen here will let you see where it's broken down by community education mobilization. This is where this screen here is it's the same setup as your compliance reports that you turn into you turn in every 6 months. So here you can come here to see how many hours were reported by the month across here for community education mobilization, merchant education, etc. In reference to finding out how many hours you reported by the 4 different areas here for Synar. Also have the totals, the grand totals here, but then this, if you go lower, it breaks it down by the month. So you can have a way to compare how many hours you have reported for Synar. Okay, so the next thing is the search Synar merchant. Okay, so Synar merchant. So this here gives you a breakdown of how many routine visits you had, how many that you reported maybe need management follow-up, if some were reported they didn't have state signage, tobacco, the ones that you did that were reported as FDA non-compliance, the ones you followed up on, as well as the tobacco survey. So you can see all of these areas here. At a glance on this screen, you can get a detailed CSV file. And this information here in this CSV file is the same file that you can pull from the merchant track. Where you see the same across the board, a flat screen where you can break it down by the zip code, the type, when was it visited last, etc. So it's very important that these reports only work when you put the date in. So going forward, starting in July 1, you are able to put the date in. Prior to that, you may not see some of the merchant visits that you did because it wasn't a, if you did not put the dates in there, it's not going to pull that report. It's not going to report that you completed that. Yeah, I keep wanting to go back.
but we got to go to the X to go to the next screen. Okay, so the next one will be Synar process. Okay, here is the aggregate counts of the number of questions, yes, no's, that you did for the different 4 sections here, community mobilization and education. So if you responded to these questions, it counts those, the responses of yes here. Now to get a detailed report of your process information, you have to download the detailed CSV file. And here you'll get more information in reference to what you reported, the breakdown of the gender, your reach, in reference to when you have completed a catchment area or as you are counting your merchants as you go along here. And it's broken down by age, gender, and ethnicity. Okay. Any questions about reporting? Jamie, you want to give us those general questions?
Let's see. We may have a new question coming in.
Okay.
I will send this question via text to make sure that I appropriately represent it. And the other general questions we have actually addressed as we've run through the process.
Okay. Okay.
So I just sent a new question to Jessica.
Hold on just a second.
So I think part of what people are looking for is for us to tell them what to put in for a billboard or some kind of poster or whatever it is that you're paying for. So a sanctioned media message. And so I have suggestions of what some people are doing. Some people have said, oh, we want to put your name, we want to put the logo, we want to put all that. What we're butting up against is anything that we do with our name or our logo on it has to go through our media department. And so, and this is sort of answering the question and not really. If you're interested, if you have ideas, I would advise that you send them to us and have Rhonda and Alonda look at them and see if it's okay. Some people had just a couple of different phrases on it. We can collect some of that information. But at this point, given the tight turnaround time and the fact that we're trying to get this out in about 20 days, I wouldn't put our logo on it. I wouldn't put our paid for in part information by it. You're kind of, I know this sounds not as great, but you're kind of on your own, other than we are happy to look at the information that you're giving us and make recommendations. But we don't have anything necessarily that I would say would be 100% sanctioned off the top of my head. And so I know that sounds a little bit scary, perhaps, because you want to do the right thing, and we appreciate that. But we certainly have some ideas. If you want to take information from the red flag material, you certainly can do that. You can have a recommendation to check IDs or however that may look. We're certainly happy to look at that. But in terms of a sanctioned message, we don't have one as of right now. Some people, I would say this, some people have already reached out to like Ann Houston Staples from the Department of Public Health. You're welcome to do that. You're welcome to check with other folks, other agencies. You're welcome certainly to check with us. again, we're happy to give you suggestions, but in terms of one message that we're encouraging, like a lock your meds, we don't have that available given the tight turnaround. I know that's not very helpful.
Jamie, any other questions?
Not currently, nope.
Okay, so let's talk a little bit about environmental scans. Can everybody hear me? Jamie, will you let me know if you can hear me or not?
We can. Thank you. Yes, ma'am.
Great. And so I think people have been asking for more information about what do we do if we've chosen environmental scans within the Synar Pilot project. And so we just wanted to give you a couple of different pieces of information about what's going on and why it's necessary to do environmental scans. And again, I think it helps for a lot of different reasons on doing environmental scans. I think one of the purposes is to identify those vapor stores, the CBD stores, and or those kratom locations. As we well know, they come and go. They pop up in locations like in, for example, they pop up in a lot of shopping centers and little boutiques, and then they are closed in 2 months. I think it's important to get that information, get a sense of where they're at and what's going on in the store. It's also important if you go into those stores or when you go into those stores that you're noting any kind of FDA or ALE violations around signage. We're also asking that you update your retailer list to add those new locations, including the vapor stores. So you're doing a couple different things. Some of you have asked for particular forms. And, yep, perfect. Alonda's going to help me. So what we found is out of the state and community tobacco control research, a lot of you have used this kind of form for regular merchant education visits or regular environmental scans, pardon me. Here's one that they've put together for vapor stores, V-Stars. And so some of you have used the STARS forms. So this has a lot of information that's typical that may be found already in your Ecco. But you can start looking at demographics. You can look at the type of products sold, again, whether or not there's electronic devices sold, e-liquids and juices, what kinds of messaging is here in the store. Also interesting if there is are customers mixing e-liquids in the store? Can they have, let's see, what else is here? The cartridges, the price promotions, sample products. Some of these things I think will lead us on to other, if you have a community who's very involved, some of these questions around price promotion, some of these questions around marketing materials, that might be a particular place that you could do some policy work as you move forward into this information. But for the purposes of the Synar pilot, we're asking you to choose a form, and we've got a couple of different ones. This is the one that we found, the V-Stars. And we're also asking you to collect that information for each of the stores that you go and do environmental scans with. And then we're asking you to upload a summary of that form. For example, it looks like this, and we can send this to everybody. You can upload this into the briefcase of Ecco. So how many stores did you visit per month? What were the environments? Any kind of particular products sold of note? What did you see most frequently? If there any kind of health message or promises about, is vaping safer than cigarettes, or is vaping a way to decrease your regular smoking? Was there any kind of specific group targeted, and so on and so forth? It may be more particular. Maybe there's a military spin or a college age spin. These are the things that we would like you to upload into Ecco as a result of completing the environmental scan. Any questions about the environmental scan piece or the summary template?
I don't see any new questions yet, so all clear.
Okay. So we've got some questions that were collected from users before, essentially around wanting to make sure that we covered some pieces around how to do the coverage study, and I believe that we went through that. Okay, as it relates to the merchant tracker. We had another question around the Synar expansion pilot and something that I thought was really important to address. And that was, you know, why does the state always give this information to us at the last minute? How can we expect it to do this very thoughtfully? And so on and so forth. And why did everything change? We were told December 31st, and now we have to do September 30th, and what happened and what's going on? So I wanted to take a moment to address that for a little bit, because as I mentioned in my email, I am very apologetic. I do want to follow best practices, so I will say this. So the reason that we have this money is because our budget office let me know on July 29th that we were underspent for prevention block grant, meaning we didn't spend all of our monies that were set aside for the prevention block grant. And what happened is we have until September 30th, because that's the end of the federal fiscal year, to spend down money. And we also have, and so what happens is all of the invoices and all of the billing have to be submitted to our state office by September 30th. So if you have questions about billing or invoicing, I would really encourage you to reach out to the oh my goodness, the LMEs who are actually going to bill our office. But so what happens was, our state budget office has until December 31st to reconcile everything and make sure that everything was spent. So that's where I originally got that December 31st date, but that's not time frame for us. All program work has to be done by September 30th. And so the December 31st is our budget office is going to get the invoices from the LME, and then they have 90 days to close everything out. And so that's where the confusion came in, and I do apologize for that. You know, I think it's really important, if we don't spend our money down, we are, as a state, we are penalized, and that means that we have to use state resources to pay back the federal government, and it doesn't look good for us as a state. So as I mentioned before, we had reached out last year when this was the case, and we had included some specialized projects for statewide entities. Well, this year we decided, because Rhonda and Alonda and I have been talking a lot about wanting to do some Synar work. The time frame is not ideal. It's a quick turnaround time. It doesn't allow a lot of thoughtful, coordinated efforts. I think given all the questions and everything that we've fielded for the last couple of weeks as a result of this, I feel like most of you, all of you, are doing the best that you can possibly do in that time frame, and we really appreciate it. We're hoping that these additional dollars will springboard efforts as we move forward after September 30th. So in October, November, December, and so on and so forth. To really think about, you know, should we continue to do merchant education? Are there locations that are continuously on that FDA violation list? Should they be checked with the tobacco survey? Should we actually start building some relationships with our local law enforcement, or conversing more with local ALE agents in our communities? Should we start starting to think about maybe some subtle hints around doing some additional work around maybe compliance checks? I mean, this is our opportunity to do it, to springboard off. And so I do, like I said, I do want to state, you know, like I said, I'm very, very apologetic for getting everything jumbled up, but I feel like this is a way that we can start to springboard some initiatives. And then, you know, a couple other comments were made about, well, you know, we really need more money per county. We really need more staff. We really need more, the ability to do more of this. And what's happening is, so this is the second or third year that I've been made aware of this. We're consistently underspent in prevention block grant. And so from a state level, it's really hard to advocate for more money for folks when we can't spend what we have. And so one of the things that we're going to be doing, and unfortunately the hurricane disrupted this, but I was supposed to sit down with our leadership here at the office, at the Division of Mental Health, and our budget office, and our prevention and treatment block grant folks. And we were supposed to sit around the table, and we're going to be doing that this month, talking about how we can make sure that everybody is spending the money that they need to appropriately in a timely fashion, and so that we don't have this confusion of what's going on, and for us to know only at the end of July, which doesn't allow us a lot of time to be really thoughtful. So I wanted to be as open as I could be about this. I know that this is a big concern. I know that there's a lot of questions that came as a result of all of this. You know, other questions that are coming about as, can we look at allocations for providers? We could use some more staff in specific areas. Absolutely. One of the things that we're looking at doing is realigning prevention block grant dollars. That was a question that came up, I believe, unfortunately it came up in June of this fiscal year. But that would be something that we would consider potentially doing, not for this fiscal year, and maybe not even the next fiscal year. Believe it or not, it takes a lot of work. But you know, something where we're looking at restaffing or making sure that there's a certain dedicated staff time frame, you know, an FTE, for example, in every county. And that's a little bit, I wish. That's a dream wish. But yeah, we can definitely start to look at that as we look at revitalizing and sort of rethinking through our prevention system. Okay, we've got a lot of questions coming in. Thank you so much. Somebody talked about, is there a sanctioned media message maybe for recognizing merchants or promoting reduced access to vaping products? Okay, we've already answered that one. Awesome. So another one is, when we're entering demographic information in Synar, will that information now be included on the state report under the demographics? We had not counted merchants before in the demographics. Yes, anything that you put in the demographics piece, that master reach piece, will now be included in our environmental strategies for the report that I do in December to SAMHSA. Another question was, can an agency logo and one of our partners' logo be put on a billboard to show collaboration? I have no problem with that. Absolutely. Yep. I see Jamie's got some more stuff he's asking for. I do want to look through. We did have some questions, as like I said, before the Synar webinar. I think we answered most everything, but I did want to talk about the Synar funding and the timing, and why is the state screwing us over? And again, that was not our intent. As I mentioned, the documentation needs to be submitted with, what documentation needs to be submitted with invoices. Please check with your LME. I know some of you had submitted budgets. I'm not quite sure what all of you submit with your FSRs, your regular FSRs, but I would check with your LMEs to make sure. And everything needs to be sent in to the LME by September 30th. So I would imagine each LME will have a particular deadline for you. That would, I can't speak to their internal deadlines. So we have some questions here about, can stores have copies of a poster, or do they only need to display the red lettered poster?
there are specific dimensions in the state law. So the reason why we have those copies of the law in your red flag packets is to be in compliance with that. So any type of handwritten copy, but we're really trying to stay away from that because it may not be following those what's outlined in the actual law. So you all have plenty of access to get additional copies of the state law. You don't even have to use an additional red flag packet to get another law. Those of you that order off of the website, you can order the law signs come in packs of 10. So I would encourage you that as you order your red flag packet, that you also order multiple packets of that law sign so that when you're out, you can give them an additional law sign. If you go into a store that seems to be in compliance, but they have some handwritten copied poster up, please provide them with one of our posters.
The next question around that is, are we to suggest and make notes about if ads are lower than 3 feet tall?
Tobacco ads? That's not a part of the statute in reference to the youth access law. So if they ask for your insight, then that's something that you can. Sometimes I would just say some things you probably just need to refer back to ALE and see what ALE get involved with that, because their local ALE is the ones that have to enforce the tobacco signage laws and things like that. So I would just kind of stick with education. If that answers your question about that.
So if we see no ID checks or the sale of Lucy's, do we code it as a manager follow-up or an FDA follow-up? If you see
So the sale of Lucy's in North Carolina is an FDA violation. Surprisingly, not a state violation. So you could code that as an FDA referral if you see that. And then the no check ID, they're supposed to be checking ID for the state and federal law. So you could send that over for the law enforcement referral if you see that they are out of compliance with that over and over again.
Okay, I had another question about what's the difference between the VSTAR form, the environmental scan form that we showed you, and the report that we showed you as an example of what to upload every month. So, for example, if you have multiple staff or if you're the only staff person, what we're asking you to do is if you're choosing to do an environmental scans with vapor stores, we're asking you to consider using this form. Again, it's not required. We do have a couple of examples for you, but to take these questions from the VSTARs and to use this form for every store that you go and do an environmental scan with. However, because we know that Ecco is so, we don't have a lot of room to upload 17,000 forms, what we're asking you to do is then summarize this environmental scan. And this is the summary piece. So again, you're putting your name, how many stores did you go and do environmental scans with? How many were considered vapor stores? How many were kratom stores? And so on and so forth. And then you're putting information in that you would like us to know about each of the stores. So again, it's where were the most stores located? Were they in sort of abandoned shopping malls? Were they standalone? Did they have, were any kind of certain communities targeted over others? So feel free to look at the summary form, which, by the way, Jamie will be sending you an example of at the end of this webinar, and to put in information for this. We were trying to make it less, sort of, cumbersome in terms of trying to upload every single environmental scan form, and for you to just do a summary per month on the environmental scans that you do. Okay, Jamie, feel free to let us know. I'm just going to go through a couple other questions. We showed you the tool and the form for environmental scans. A question around, is the We card through the FDA different than the We ID program? So the We card program, in my opinion, it's an alcohol industry program, but I do want to know a little more about the We ID.
Yeah, I'm not familiar with the VID unless that's their new slogan for their new campaign they just recently started
For FDA.
for FDA. They have a new campaign they just launched, but I don't recall it being called WeID. But if that's what the new media campaign is, then that's what it is. I have to go look online to see what they call it, but I didn't recall it being called WeID.
And please don't use We card.
Yes.
But you know, whatever the FDA campaign is called, we certainly support FDA campaign.
Right. For the free materials that they provide.
So another question that's sort of general. Is the list we are given only generated from the FDA infractions website? So I'm going to make some assumptions here about a list. So the list that you have in the merchant tracker is no, it should be everything.
Yeah, so everything that we had as far as 2 years ago, we no longer send it out to you, is the list that was the generated list that was used, that the FDA team used when they go out and do merchant, do their compliance checks.
So what we are asking you to do, however, is if you're doing tobacco surveys, purchase surveys, we're asking you to start with the FDA infractions from 3 to 6 months prior
on the FDA
on the FDA website, and we can certainly direct you to that website link again. That's just a way for you to be able to start somewhere again, because we have so little time to do this. It's really important that you start somewhere versus taking maybe an entire zip code that may be a lot, or an entire county that might be a lot on your list. So only for the purposes of the tobacco survey would you start with the FDA infraction website. I think we've asked this, but answered this. I think it's worth mentioning one more time. And we've always counted travel prep and planning as part of our 8 hours. Can we continue to do so? Absolutely. Now we just have a way for example, for managers to be able to see how much how much direct time is being spent versus how much indirect time. Yes, please, absolutely. Count all those hours. It certainly counts towards your 8 hours, because there's no way that you can do, for example, merchant education without having some kind of travel and some kind of prep time. Another question that came as a part of us talking back in August, it feels like so long ago, but it wasn't. It was mentioned we could purchase items for law enforcement. What are some examples of those items? So first off, I would really, really encourage you to reach out. If you've already got existing relationships with law enforcement, I would reach out and ask them what they would be interested in. Now, obviously, we have some limitations. We can't be buying. I would love to be able to buy another squad car, but we can't do that. We certainly don't have the money to be able to do that. Plus, we can't purchase any equipment over $5,000. But it may be something around, we need ID checking guides, or sometimes for checking the veracity of fake IDs, sometimes that you use black lights and things like that. But what I would really do is encourage you to ask your local law enforcement partners, is there anything that we can help you do? Anything we can help you check off if you need some help with this pot of money. And if you have any questions about whether or not this would be allowable or not, please, 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 please send us an email. We're happy to help you with that. Trying to look and see if there's any other questions. Mainly, I think we've answered most of the questions that came in before the webinar, but I want to turn it back to Jamie and see whether or not there's any additional questions that have come up as we've been talking and going through the webinar.
Nothing new currently, Jessica.
Okay. We can pause, or if there's anything else that we have here. I'm always willing to get you guys out a little early.
Let's see. We may have a new question. Hold on. Where do we document environmental scans within Ecco errors? So how do we code environmental scans?
we code environmental scans? Okay, great question. Yep, we're going to go back to Ecco here. Oh, sorry. So the question that I would ask Rhonda and Alonda is, do we consider environmental scan Synar, or is that an environmental other category?
I guess if they, I think some people chose that they were going to do the CPD in the kratom environmental scans. That will be an environmental other. So if they are doing environmental scans to try to add the vape shop to their merchant list, then that would be environmental sign-on.
Okay.
Do they get?
Okay, so I think what we're hearing is that we would have you put it under Synar if it's for vapor stores. And so what I'd like us to do, I think it's a great question. I want to make sure that we're not just talking off top of our head. We can get back to you guys and give you the specific information about where to put that. So it sounds like environmental scans for vapor stores is definitely Synar, which was in the MOU. And then anything that's not, like the kratom stores or CBD oil stores, if some of you remember, I was talking about a mobile store that's a glass truck that drives around my little town. And so if I was to do some kind of scan of that, I would not include it as Synar. So let us put our heads together today and get back to you about where exactly to put that. But I want to make sure that we're not just talking off the top of our head. It's a great question, and thank you for helping us think through that. So I'll get back to you. The answer is we'll get back to you.
Don't put any environmental scan hours in just yet.
In the interim, you could still capture that information on your environmental forms.
Make sure that you do know. Walk away. Think you definitely can do environmental scans. Vapor stores is Synar. Just make sure that we'll tell you exactly where to put it very soon. Thank you.
Anything else?
We have one more question.
Okay.
Well, we have one more question I'm asking for clarification on from the submitter. So we'll wait just a moment, and I think we may be caught up.
Okay.
In the meantime.
Okay.
And if we don't receive clarification, we will make sure to follow up offline.
Okay.
Sure. And if anyone has questions that we somehow missed or made things a little bit cloudy or have questions afterwards, feel free to email me and we can make sure to track those and identify the answer.
Great.
Okay. We don't have any new responses currently.
Okay. Well, then I would say thank you very much for your time. For those of you who are going to be coming to Winston-Salem on September 12th or Raleigh on September 13th to talk specifically about the protocols and how to do tobacco purchase surveys, we're looking forward to seeing you. We really, really appreciate your time today. Thank you for adjusting your schedules because of the hurricane. As always, please reach out to Rhonda or Alonda, or even me if you need to, about billing stuff. Please reach out to Jamie in the TTA Center. Thank you so much for your time and all of the work that you're going to do on behalf of this additional Synar extension pilot, as well as just even the general Synar work that you do all year. We're really excited. I think we're going to be able to share with you some information soon about the Synar survey. So I think that's going to be helpful. We're going to be able to see that toward the end of almost winter at this point. But you guys have done a lot of work, and it's been really, really helpful over the course of the last year and a half, 2 years to get us to this point, and we really appreciate it. So again, on behalf of Rhonda and Alonda, unless there's anything else you guys have, thank you so much for your time today, and we'll see some of you on Wednesday and Thursday. Oh, Thursday and Friday, my mistake, sorry. All right, bye everybody.
Thanks everyone. We will send out links to the environmental scan information, and everyone will receive a survey to complete in about 60 minutes related to the webinar. And we hope to see everybody this week who is attending the webinars, or the face-to-face trainings. Thank you. Take care.